You are watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. With us, we have an expert on the topic, board-certified prosthodontist, Dr. Kenny. Dr. Kenny, welcome to the program.
Hey, thank you, Randy.
Okay, so now with the denture wears.
Yes.
You know, and I've told this to other dentists. You know, my mother, 74 years old, and she's been in dentures since she was 30. She says, Randy, don't try to tell me, you know, after talking to you, don't try to tell me that, you know, I could get dental implants. I'm too old. My medical doctor said they'll fall out. What is your response to that?
Well, I've heard that before, and a lot of times patients have come into my office thinking that, only to find out that we were able to help them with dental implants. I think the person who has no teeth at all and has that denture is probably one of the most exciting patients to treat.
Really? Why is that?
We can change their smile, we can change their perception of themselves, and we can give them stable teeth that they're able to now eat foods that you and I would eat that they may have passed on for many, many years.
But at 94, I mean, why would they want to do it, go through that process of dental implants?
Randy, they want to eat and they want to smile and they want to do those two things with confidence and comfort. And when you have a denture that you open up your mouth and every time you go to talk to somebody, or as I've heard them describe it, they sneeze and their teeth come out of their mouth.
Is that right?
That's an embarrassing situation.
So those are
for
real
them.
stories when
and
you
so,
hear that.
Yeah, well, you know, these are stories that I've heard over and over and over. And you know, when you see them out and you just watch them eating, I can tell you that when a patient has a denture, the foods that they eat and the way that they eat them are different than the way you and I would.
How?
And so,
like what? I mean, it's kind of like a cow, like rubbing things together? Or?
Well, that might be part of it. I mean, certainly you can see, you know, just how their mouth functions differently than you and I. But
you could spot
beyond
in a restaurant. You could spot a denture wear.
Well,
can you?
Yes, I can.
Okay.
But the other part of that, Randy, is the foods that they would eat and how they would eat them. For example, you and I would bite off an apple, and a lot of times somebody who wants to eat an apple or corn on the cob, somebody who wears a denture, they just can't do that. And when you anchor the teeth with implants, then life changes for them. Now they're able to eat those types of foods again.
If dental implants, especially for the denture wear, are as good as you say they are, why isn't everybody doing it?
I think one of the things is just they are unfamiliar with the process. These are patients who, on average, get their denture and don't return to the dentist for 15 years.
Interesting.
Once they have their teeth, they think that they're done. They no longer need fillings. They no longer need root canals.
So nobody's telling them to do it. That's one of the reasons, maybe?
Well, certainly no one's telling them to do it because they have their dentures in their mouth and they think there's no other option. That's kind of like the end of the line for them. At least that's what they've thought.